Now, Judith, welcome everybody to the webinar series. With today, we're going to have the top health and safety leaders share tools for management. My name is Dan Fleming with NORCAT, Health and Safety Organization, nonprofit organization, support the League of Champions. I'd like to welcome everybody here for our League of Champions series. We're looking forward. We've got two special guests here today. We've got Ron Kaluski, the Chief Prevention Officer, who's going to be speaking on some of the new government requirements that have been coming in. And we also have Erin Oliver, who will be speaking. Erin's with Modern Niagara, and she's going to be speaking to us about health and safety culture and some very good, interesting presentations. So just as everybody here, we've got some Q&As that you can ask. So we've got about 150 people that are joining us here today. So please, if you'd like to ask a question throughout the presentation, please use the chat box or the Q&As at the bottom of the screen, and then we'll follow those questions as we go through the presentation. Webinar is being recorded today. I'd like to remind everybody, yes, to use the Q&As. And I'd also just like to now introduce Craig Lesurf. Craig's chairman for the Gillum Group president, and give us a little background on the League of Champions. Go ahead, Craig.
Great, thanks very much, Dan. So welcome everyone. Hope everybody's staying safe these days. Certainly interesting times, and we're going to hear some great speakers. The League of Champions, it was set up a few years ago, and it's basically a number of industry patrons and members. And right now we're at 60 plus members and over 20 patrons. And what we've done is bounded together and realized that safety crosses all boundaries. And we have organizations from generals to subs to owners to municipalities to other associations. We even have unions, we have non-unions. It's great to see that safety is crossing boundaries. And the idea here is that we band together and we have a common cause, and that is the promotion of safety. And safety is paramount, I think, in everybody's mind, especially these days. And with the League of Champions, it comes with a simple promise. And the promise is that you're going to work safe every day, and you're going to make sure that people beside you go home safe every day. And then everyone on your job site goes home safe every day. And you're going to do that by signing your name. And you're going to usually sign it on a jersey. And you can see we're all wearing jerseys here. And all these signatures represent people that have committed personally. They put their family name on something and they basically signed a contract. And the contract is they're going to be safe. And that's the idea. It's a way to change your culture, your safety culture. Many of you might be members or should be members, but we hold these webinars open for everyone. And we're looking forward to expanding the League of Champions and bringing in good companies and changing the safety culture across Ontario.
Awesome, so, Craig, thanks. Go ahead, Craig. Do you want to speak?
No, you're good.
Awesome, thank you. That was great. I'd like to also introduce now David Frame. David Frame, Director for Stakeholders and Government Relations with the Ontario General Contractors Association. David, tell us a little bit about what we can expect to see with the League of Champions.
Thanks a lot, Dan, and thanks, Craig, for your leadership on these. Craig's been a driver behind the League since it started, and the League owes Craig an awful lot for what we've been able to accomplish. First of all, I want to start by recognizing just a few of the special guests we have on today. Martha George is on. She runs the Grand Valley Construction Association, and she's on our advisory group, so thank you, Martha. Scott McKay is on. Scott is with the Threads of Life, great organization that helps families who've experienced workplace tragedy, and we're looking to work closer with Scott and Threads. Ian Cunningham is on from COCA, another great supporter. And Joelle Malou, the OGCA chair, is on with us today. So glad you could join us, Joelle. Thank you. I just want to let you know is you may have signed up for a webinar which also included Norm Keith. And about 10 days ago, we recognized that we had a lot of material to cover, and we don't like to push our webinars past about an hour and a quarter, hour and 20 minutes. And Norm clearly had enough material to fill his own webinar. So we said, okay, Norm, we're going to give you your own webinar. So Norm has agreed to back off of today, but coming up on December 15th in 2 weeks, Norm is going to present risk management for working safely during the pandemic, occupational health and safety, Workplace Safety and Insurance Board, Labor Relations and Employment Law Compliance during the pandemic. And we will have notice of that webinar out to you in the next 24, 48 hours. Always a great session. We've had on Norm on twice before. So look for that, and we'll have lots of time for Q&A on that. As Dan mentioned, the webinar is being recorded, and we should have this up on our website in the next 24 or 48 hours. Thank you, everybody.
Awesome. Thank you, David. Thank you. So that brings me right into our special guest we have here today. So let me first introduce to you Erin Oliver. Erin is Vice President for Health and Safety Sustainability at Modern Niagara Group. She's been active in health and safety for 27 years. She has a degree in kinesiology and minors in forensics. She's worked very hard to prevent injuries, occupational disease, and fatalities in the workplace. She has a business diploma at Sheridan College and is currently working on the MBA with McGill on a part-time basis. Erin joined Modern Niagara in 2015 in the current role. She manages the company's national health and safety program that ensures all employees working in a secure environment. Her role also includes corporate social responsibility, wellness, and sustainability. And in 2020, Erin was honored by Modern Niagara as the One Modern Award for excellence in living in the company's core values. Also, Erin is a member of the Prevention Council with a mandate of Ontario's Safest Employer and is currently the chairwoman of the council. Myself and also Ron are also on the council, and she does some great work there. Just recently, in 2020, just last month, Erin was honored with the Avita Award for Canada's Safety Leader of the Year and from Key Media and the Canadian Occupational Safety Magazine. She also won the Gil Sampson Award and the Roy Pennymore Award from the IHSA for her services on the Ontario construction sector. And the list goes on of Erin's attributes and her contributions to the industry. So it's a pleasure to introduce Erin. She's going to give us a little bit of a talk about honing intuition to better the health and safety culture. So please let me introduce a friend and associate, Erin Oliver. Go ahead, Erin.
Thanks very much, Dan. Judith, if you wouldn't mind getting the deck up so people can see it, I'd appreciate that. And thank you everybody for attending today. It's a really great attendance. I'm impressed with the number of people who have come to listen today, and I'm sorry if I'm the pale exception to Norm's presentation, but I think this will be just as much fun. I'm sure Norm will get a chuckle out of it as well. So while the deck is starting to load, I wanted to take a different perspective on health and safety. You know, I've been doing this a little while now, as Dan disclosed to you, and over the evolution of health and safety 27 years ago wasn't a profession. It was a task, and then it became a very technologically driven task with a lot of data. And it's gotten to the place now where I think culture is really important, and the evolution of the human-centered approach to safety is coming full circle. And I think it's really important that we get to that point, because this is about people, and all the data points that we look at to define our programs are about people and made by people. So each number that we assess every day is truly a number that's been developed by people. So wanted to kind of bring that full circle, and there's a science behind this, and that's what's so powerful. It's not unfounded in science. It's very objective. It's got a lot of rationale to it. So please, if you have any questions during the session, put them in the chat box, and I'm sure it'll get moderated as we go, and we can start the conversation. So I've been working on this deck for a bit now about honing your intuition and insights into leadership for organizational innovation, success, and sustainability. And you'll notice health and safety isn't in the title, because I think it's more than that. It's about developing a holistic approach to organizational management, where safety is one of the key cornerstones. And without the other things like the willingness to share and the respect and trust for one another, a lot of things fall flat. So it becomes, the title would have been so big if we captured everything about what is important about intuitional leadership, that I felt this was where I wanted to rest. Judith, next slide. Intuition itself is guided on instinct, and I think it's really important that we start looking at the key factors around this. And before I get into some of the stuff that Dan talked about and who I am, I really wanted people to recognize that now more than ever in a black swan event like this, data and analytics don't exist as we try and manage through COVID. COVID is going to be one of those things that we do well because our gut instincts and our moral and ethical boundaries tell us what the right thing to do is. There is no science that is, this century that will allow us to create any kind of context. And we're seeing this as the province scrambles to create best practices. And they're doing so because a lot of that has been guided on instinct and good judgment. And then the data is backfilling and now nudging us into better positions than we were. And what my challenge to everyone here is start to recognize that when you've got events that don't have any historical data or historical precepts to them, you're going to have to figure it out whether you like it or not. And some of those things come with good morals and good ethics, a good understanding of the system, but first and foremost, a strong understanding of ethics and intuition. So I won't go into a lot of this in detail, other than to say all of my career has been spent heavily involved in construction, mostly mechanical and electrical. But a lot of my career, and especially the latter half of my career before I came to Modern Niagara, was spent in forensic reconstruction of fatal accidents, and most of which was in construction. And what I noticed about that very, very moving career journey that I had was that all of the people had answers and solutions to the consequences that caused the fatal accident in the first place. It was the ability to create an intuitive methodology to have brought all of those answers forward and created a strategy around those answers that was missing. It was that cohesiveness. And as you've heard, I've been a committed person to health, safety, and improvement of human performance, the essence of kinesiology in general, right from the beginning of my career. And even so much so that I worked with the Kinesiology Association to develop regulatory standards for kinesiologists in human performance. And I believe strongly that this is a profession. And I believe strongly that you need to have the right skills in place to give people legal advice and ethical advice and healthcare advice and guiding advice that's going to keep them safe and healthy in the first place. And I have a kind of a one-page mantra myself that health and safety must become an open source process. No worker's health and safety should be leveraged as a competitive advantage or as a unique scenario unto themselves at the expense of anyone else. So if somebody's got something figured out, that should be shared because no other person should be disadvantaged by that. All right, we have some chat. Okay, good. I just wanted to make sure that there's no questions in the chat room. Thank you. Next slide.
Great, that was a great point that you made there, Erin, just about the sharing, and that's a lot what the League of Champions does is the sharing of all health and safety, and it's not proprietary. Awesome.
Yeah, exactly. Absolutely agree with that. And a lot of people in their careers think that they're going to become the CEO one day, or they are going to become the vice president of health and safety, or they're going to become the construction manager of their division, or whatever goal they see for the end of their career. They see their path is quite linear, and I challenge people to lift their head and look around and frankly spin around, step sideways, step backwards, because that's truly the way innovation does work. It is very non-linear in its methodology, but I'm going to propose a linear model in a moment. So I'm going to eat my words in a way. But what I also want to demonstrate is this isn't in the absence of law and regulation. And if you think about this like the great Canadian hockey game, the law sets the boards and the rink and the boundaries and the lines and all of those parameters. And the Ministry of Labor is our referee. They're the ones that are going to make judgments on whether we obeyed those laws or not. But at the end of the day, the folks in this presentation and the folks attending here today are the coaches, and they've got to put together a team, but also coach them and build that trust amongst the players, being your employees. They've got to, create the plays and the shot plans and all of those things, the defensive strategies. And that takes a lot of intuition and understanding and skill, and it takes experience. And all of those things have to come together, because even great experiential players, and I'm going to pick on Wayne Gretzky for a moment, one of the best players ever out there, wasn't the greatest coach out there. And you know what? That's okay, because there was some great coaches that he worked with, and he created great coaches out of his great experience. So, you know, recognize your fit and live to that fit really well. Next slide, please. So here is that linear path that I was talking about. And this comes from Forbes. So Forbes has got some scientific background to this, but the general innovation pathway is born out of a learning journey of experience. So you can't get to innovation, very much like Maslow's hierarchy of needs. You can't get to the next level in the chain without understanding and delving into the previous level. So at the bottom is data. Numbers, nothing more, just numbers, but understanding what those numbers represents becomes information, and the ability to sort and organize that, to develop information sets, starts to drive knowledge. And this is where we see a lot of the entry-level safety professionals. They're starting to learn what data to look at, what knowledge they can achieve out of that. But as you progress, it's really important that you look at getting some insight into things and start to prognosticate, if you will, what you're looking at. And if you sit back and think about that and give yourself space to think, that's when the inspiration comes in. Once you start having inspiration, you get intuition, and only when you have intuition will you have innovation. You marry a bunch of those things together, you will have an innovative safety program, and it's born on both data and analytics and science, governed in the knowledge of the legislation, and you start to build on that experience, and you will be innovative by your nature, because you've introduced and harmonized a lot of these strategies. So what can leaders do to inspire organizational success and sustainability as we navigate through this period? And I use the word sustainability because even health and safety has to be sustainable over the long run. You can't spend so much on health and safety that you bankrupt the organization, but you can't underspend so much that you risk bankrupting the human capital of the company. And those are very important balances to strike. Next slide, please. So here it is all broken out the way I think in the world. So data is only as good as the collection of it. So you really have to focus on what data you want to collect and why. And you do that before you start collecting the data. So if you're planning on a new health and safety strategy, what outcomes do you want to look at? What KPIs do you want to measure? What are the things that you think the data can tell you that'll stride toward your journey of that new initiative? But that's just the data. Now you've got to start collecting the information around it, making sure that it's captured the same way, that inter-auditor consistency, or the foremen that collect the data collect it in the same way with the same vision. So that means you have to impart some knowledge on them. Make sure they understand what they're doing, how they're doing it, and that inter-collectible dependency is really key. And skilled practitioners can leverage that information and the stories and experiences on others to start building that data and information into a knowledge set, case studies, for example. As you start to build insight into what you're looking at, you can start to think forward, project, and forecast. Forecasting where the safety risks are going to be in a construction project, for example. One of the first questions I ask my team is, what is the manpower curve of the job going to look like? And it's not necessarily the peak of the job that's the high risk, it's the rate of change of that curve. If the curve is exceptionally sloped aggressively, then that rate of change for me is a risk. If there's multiple curves and the rate of change in that manpower is changing frequently, that is the insight that I have, that it's the change that actually is the risk, not necessarily just the peak. The peak, right now we're in a peak of a pandemic, but everybody's gotten comfortable with the process. It's getting to that peak that really stunk. It was hard. It was a lot of change, and a lot of change in how we procure things, how we put things out, how we screen things. So, you know, that's where you get inspired to go and look outside the box. Okay, I can't get masks. What can I do differently that's going to get people protected? I can call a competitor and say, ask if they have masks, and offer to barter and swap. And I've never seen this in the history of health and safety. Competitors, allies, subcontractors to general contractors were calling one another and asking to barter materials and supplies so that they can all cross the line together in their projects. And I would challenge everybody listening today to continue doing that after this pandemic is over, because only that way do we have the best performance by everybody on the project. As you start to get that inspiration and new way of doing things, like bartering safety supplies to make sure everybody's still protected, you start to develop an intuition and you get inspiration from the stories you're hearing in the field. You know, you see these YouTube videos where doctors are describing their glasses fogging up. Well, that happens in construction all the time. They're putting Band-Aids on the nose of their mask to keep the fog from going up into the glasses. So now you're starting to see new types of bandages with some sheet metal in them that are being sold on Amazon that are just the creativity that's coming out of this pandemic is also as inspirational as the pandemic is threatening. And we have to look around and look for those things. Once you start to get that intuition, that's when the innovation happens. Innovation happens where intuition and need really intersect. I need something and nothing exists in the common space right now. How do I make it happen? And right now is a real solid innovation change point in history. And all we have to do is lift our head from getting through the COVID every day and look for those places for innovation, because I would strike a challenge to everybody here and say, this is probably one of the more innovative periods in health and safety in our history. And we can be very innovative right now and come out of this very much further ahead than we had been had COVID not happened. And I would never wish that it had, but I'm saying we have this opportunity to find some really great diamonds out of this really pressurized situation. All of this in mind, remember, you can't skip steps. You have to recognize that you need the data to create the right knowledge, to create the right inspiration. And a lot of this is driven on storytelling. The stories I have are different from the stories Craig might have, or is different from the stories that folks of you listening might have. Those stories and those sharing of stories might tweak ideas where there's a harmony between the two different strategies, where both of them aren't just additive, they're exponentially more powerful. Encourage others to tell stories as well and to come up with great ideas, and never challenge bad ideas. You know, we had a first-year apprentice that challenged how the Milwaukee bandsaw was developed, and he was brave enough to raise his hand and say, I have an idea. And that idea has now matriculated into an engineered change with Milwaukee, and that was a first-year apprentice. So it took a lot of support to get him there, but it also took a lot of guts and inspiration on his part to see the value of it. You have to listen more. You know, you can't tell stories and not listen to stories in equal measure to develop a new strategy. You must rely on experience, but not over rely on it. Things that happened 20 years ago are important and may not be entirely germane to today's activities because of the rate of change of technologies and strategies and all of those things. And the key is integrating your intuitive ideas into process, but always remembering you have to circle back and back them up with data, because innovative ideas, as the times change, they can also change. Next slide, please. So innovation truly is the road less traveled. I think in safety, especially safety people, tend to enjoy their data, tend to enjoy their analytics, and forget about the fact that all of those things are human capacity at their best. We have to recognize that we can't reduce people's emotions and empathies entirely from a conversation. If they cannot figure out how to do something and we just say, because I said so, or because the law says so, they're just going to not trust you to help them do the right thing, and they'll find a way to get it done. And it might not be the safest way because they don't have your skills and experience. So give them the time to listen to their problem and find a way to work together to collaborate a solution. Some of my most enjoyable times is actually going out into the field and listening to the tradespeople describe the passion they have for their craft, because they are so proud of what they do, and none of them by their nature want to do it unsafely or with poor quality. Some of them just don't have the tools in the toolbox given the type of situation they're facing, and will get it done because that's the nature of the craft. Is I want to build this widget. I will build it as with the best quality and with the best safety I can. But if I don't have all the tools of success, I'll still build it. And that's the way they're wired. And we can come in and interject and say, but I want to give you the tools to build the best quality and the best safety product you can as well. Next slide. Thank you. So some of the experts on intuition are quite shocking, actually. These people are both experts in intuition, but they're experts in their craft. If you think about it, Steve Jobs, he said intuition is a very powerful thing, more powerful than intellect itself. Think about that. Intuition is more powerful than the intelligence of his team. And he was an IT company. For those of you who don't know, started the Apple Corporation and Macintosh, pretty successful by his own right. He depended heavily on the value of intuition. Albert Einstein said, intuition does not come to an unprepared mind, which means you take the time to understand the data and the analytics. You take time to understand the knowledge and the arena that you're in legislatively. But you have to sit and think about it. And intuition is really a powerful thing because it's what guides the creativity behind the science. And Darwin also said, when you write it down immediately, when something comes to mind, because the unconscious bias will succumb your ideas to logic, the logic that you have predisposed if you don't take the time to write it down. So if you don't journal, I'm sure all of you journal your safety observations every day, but journal your great ideas. I don't care if you use a different color or in the margins or whatever, because your brain will check those out if they go against your normal science brain and your normal data brain, if you're not comfortable with looking for those new strategies. And don't dismiss a new strategy because it doesn't work. Get comfortable practicing, thinking about all these new and innovative things. And Wayne Gretzky, I've talked about him before already. I skate to where the puck is going to be, not to where it has been. In other words, forecasting, looking forward, being intuitive, knowing the game so well that you can go to the future and be accurate. And that's a practice of intuition. But these are folks you'd want to emulate as professionals in your own career. And all three of them, and frankly, Darwin as well, value intuition to the extent that they did, that they spoke openly about it. Next slide, please. So I wanted to give you an example of COVID through the first wave with Modern Niagara. And we did something a little different. The top one is the global timeline for the first wave of the pandemic. And the bottom one is what we did through the pandemic. And of course, the first clinical case was announced in China in and around December 31st, and we were all celebrating New Year's. January 6th, China had disclosed they had a problem with about 85 cases, and we were all just coming back from holidays. By January 12th, the World Health Organization issues their first report of 250 cases that they were looking at in China. And by that time, we had actually had our first safety team briefing and talked about a possible risk of a bad flu season. By January 27th, the World Health Organization had declared a global pandemic with 3,000 cases, and we had already rolled out our first safety talk on hygiene and managing the flu and making sure that they understood good hygiene practices and not how to be a spreader. By February 14th, the caseload was pretty incredible, 50,000 cases, mostly in 25 countries in Europe and Asia. By that time, we had reached out to many of our partners, some of which on this call today, and started talking to them about a plan, started talking about them about the need to start sharing ideas about hygiene because we all work on the same projects, start talking about things like PPE, if there was going to be a shortage, because China was consuming everything that was being made at the time. And we rolled out our second tailgate talk on the coronavirus, then still known as the Wuhan virus, and talked about what a super spreader was. By March 5th, there was 100,000 cases. It hit 85 countries. And in our company, we had struck a council, not just of health and safety people, but our CEO, our COO, our CFO were sitting on this council. And we started to discuss what it was going to do to the corporation and how we had to create an austerity plan in case it came to Canada. And of course, by March 11th, it was declared a global pandemic. And we had already chaired our first meeting that included finance, procurement, ops, and our COO assumed the responsibility of this chair, and we met every single day. My job was to outreach with respect to health and safety to all of our team peers, and one of our executive vice presidents reached out to many of our labor partners, including the unions, and asked how we could help work through some of the strategies with the workers. We didn't have a crystal ball here. This was just something because I'd been through SARS as a consultant and I'd seen what it had done. We had built Humber Hospital. Toronto as a city knew what was going on here. And we had to start to look at it. And if we were wrong, all we did was we did a lot of planning. But if we were right, then maybe we were helping other people in other areas to be more successful. And by the way, Canada's first case was actually in January 27th. So it was quite early. And the fact that it made it to Canada and it was spreading across China that way was a really, really strong indicator that we needed to reach out and start talking about this more broadly. So all of this was not, prophetic. This was just intuitive. And that doesn't mean we were entirely right. But what it means was we acted on our gut instinct, and we were willing to do it with a level of rigor that a lot of others didn't trust their instincts to do. Next slide, please. So there is a science to intuition, by the way. The science of intuition itself is rooted in our endocrinology and in our hormones. So I wanted to talk about that briefly, because for those of you who wouldn't trust intuition as anything but an intangible, it's actually got a lot of physiology in endocrine science. So next slide, please. I know you can't necessarily see the picture very closely, but the links are in it, and we will share those links with you afterward. You've heard of the gut instinct. When I went through medical school, I was actually training to be a doctor. I decided that I didn't want to treat people after they were hurt. I wanted to prevent injuries before. And that's the genesis of how I came into health and safety from medicine. We learned about the central nervous system and the brain and the spine and the cranial nerves, and we learned about the peripheral nervous system. But recent science is showing that there's an enteric nervous system. In other words, the stomach is your second brain. What I mean by that is, in many ways, it is not the thinking brain that we have up in between our ears, but it is a booster, or it is a catalyst. It has some resistor potential to all those hormone functions. So it can either suppress thoughts or it can exaggerate thoughts. And that's where you get that gut instinct. That's where you get nauseated by a thought. That's where something that you see really, really makes you feel sick to your stomach. You hear all of those phrases because your gut is like a second brain, and it does enhance or diminish the power of the primary brain up between your ears. And the stomach has a lot of hormones. It is one of the larger endocrine organs now known, and it creates a lot of the hormones that amplify the fight and flight response, which is the science word for the hippocampal rote memory response. In other words, your memory center in your brain. The first place those hormones hit is that portion of your brain for memories and memory response. Next slide, please. So what does it do? Well, the gut creates pretty much three major hormones that really amplify how you respond to a crisis. Your norepinephrine or your epinephrine are combating hormones. Your norepinephrine suppresses the adrenaline in your body and allows you to continue to think logically under pressure. Serotonin helps with mood regulation. So you're not having really strong mood waves. So you see this with irritability or obsessive compulsive. You see this with addiction issues. And then dopamine is your pleasure reward center. So all three of these things are actually facilitated and amplified or suppressed by the stomach. And the stomach acts like a really strong regulator to all these things. And when all these things are in good balance, your mood and your cognitive function are operating the best. And that's why, if all of those things are in good check, your brain can function in a very logical, but also in a very creative way. Now, COVID is challenging all of this. COVID is challenging a lot of this to the extreme. And you hear a lot of people talking about anxiety and irritability, aggression, lack of attention, and fogginess. That's because the stress that's coming through their body is primarily being driven by the stress, the cortisol response in the stomach, and is affecting their brain. We really have to work to try and help these folks. And so mental health strategies are critical right now for people to keep these things in balance. And that will help the gut check, the gut instinct stay strong. Next slide, please. So, and this is also very important, because when people are understimulated, they get bored. But when they're overstimulated, that's when the gut check, the instinct goes away. They get into that fight and flight response, and they do things that are going to be saving themselves, whether it's emotionally or physically, and they forget about the teammates. And the IRS system completely collapses when everybody is all in it for themselves. And usually that's a function of stress. So the challenge is actually finding an optimal level of stress. There's an arousal level, that healthy competition, that desire to cross the line and create the best product you can. And that arousal state is that healthy challenge of going to work every day, that healthy competitive team building spirit, that collaborative support. And right now, more than any other time, it's really important to find the ability to, when you recognize that people are struggling with attention struggles and memory struggles and multitasking issues, that we've got to find ways to remove those overstimuli so that they can get back into a healthy level of arousal and produce well. And that also gives them the ability to be alert enough, not bored, that they can continue to contribute and be innovative in their contribution. That's the highest level, is that bell curve where they can perform the best. It's also the place where the hormones are best in balance. So what does that mean for leadership? Next slide, please. So managing this change is really challenging. You have to look at this change and say, okay, what is it that we can do better? And the pen is always in the hand of the victor when it comes to writing the story. So I challenge all of us here to say, okay, how do we become the authors of this future? We have to make sure that we look at the data. We also have to make sure that we look at how to manage the optimal performance of the people, because our human capital is the key to our financial and operational capital. And then we can talk about influencing their perceptions. So that's managing change. So next slide, please. Kotter is a very old model, but he was very clear that there's 8 steps to managing change, and they're in buckets of 3. You've got to create that climate of change. So that's that data, that knowledge, that insight into what's going on. You got to make the change happen. That's where that innovation and that intuition start to kick in. You start to get the action out of it. But it also means you enlist other people of like-minded and like-spirited performance to really engage and create some synergy. But you got to stay planned, and then you implement and sustain the change. So to capitalize on those wins, you really have to have a strategy of sharing and collaboration, open communication, and demonstration. You want to have show the results and celebrate those successes. And then you institute them into good policy and good practices, but you celebrate them. And the institutionalization of rewarding those successes it drives the hormones again. That's that Pavlovian response to doing good things well. Next slide, please. So people-centered, data-driven is really what health and safety is about. We're centered around people. We don't do this for any other reason other than human performance. So, but it's got to be driven in data. So the necessity at this point, I think we're at a pivotal point, not just in what we do in our workplaces, but in the province and nationally, is we are at a pivotal point of change now. Next slide, please. Looks like a busy slide, but I'll walk you through it fairly quickly. Managing complex change. Once you've made a decision, I am going to go open source and we're going to share openly. And that was a decision Modern made a few years ago, but it came with the perception of threat of risk. So if we didn't have our vision clearly articulated and the why, then it drove confusion, not just with our own staff, but with our colleagues and our peers, our buyers. Why will we do this? Why would you want to share this? Now you've eliminated your competitive advantage in bidding practices, for example. Once we get past the vision and we're very clear about that, you got to make sure you have the skill in place. And the skill comes with learning and experience. So you really want to make sure you've got a succession plan for your skills management. If you don't have the skill, then people get anxieties. They don't believe they can be successful, and they start to self-educate themselves on what they believe. That unconscious bias creeps in. If they don't have incentives, then they're going to be really slow to change. The what's in it for them is a true physiological response to fight and flight. They need to know that change is going to bring a reward for them, whether it's more efficient, whether it's accolades, whether it's just a thank you. They need to know it's coming. If they don't have the proper resources, you can't build a house without a hammer. You need to have the resources. There's a lot of frustration. There'll be a lot of change issues, and it probably won't be as successful quality or health and safety wise as you expect. And if you don't have a plan that's been very clearly articulated, people will start where they believe is the best strategy, and you'll be trying to herd cats. It is really tough to not have all of these 5 resources in place and in the priority that they're in before you have real change. Now that real change, remember Kotter said, yeah, you can have real change, but you've got to really exploit it, celebrate it, institutionalize it, make it part of your program, make it part of your culture. And real change is culture, because the culture of change itself is in of itself change. You can't have a good culture if you stay stuck in 1980 or 1970 or 1960. Good culture comes with the respect of change. And, you know, I do mentor from time to time. Some of my people that I mentor are older than me. Some of them are younger. Some of them are new Canadians. Some of them are men. Some of them are women. And what's interesting is I don't teach them. We teach each other. I learn from the young folks. They have a different way of thinking. Risk management and IT blow me out of the water. They teach me every day. It's great. And the same with new Canadians. They teach me a very cultural, diverse perspective of things that I would never have thought of otherwise. So really, really be ready for that kind of open-minded change. Next slide, please. So my last slide is really a challenge to the leadership here. As you continue to build your team and your career and your experiences on behalf of your company and the health and safety that you want to be part of, make sure you foster the development of intuition and drive innovation. That's how you're going to get good health and safety change. Operations, finance, or health and safety can be distilled to data points, but don't forget that each of those data points represent people. And those people, your human capital, have to be in balance with your financial and your operational capital, or you're not going to be successful. Intuition is heavily affected by stress, change management, and experiences. So you make sure you foster the opportunities for people to alleviate all their stress, all their anxiety around change, and bring their experiences to the table so you have the most robust solution. And take the time to develop the definition of your company's commitment to their sustainable approach in health and safety, in people management, and in success overall. Next slide is questions.
Where do we start? That was great, Erin. I learned a lot about intuition. Learned a lot about change management. A lot of stuff came back to me, but also a lot of new stuff that I haven't not fully aware of. You talked a little bit about the linear from data all the way to innovation. In some situations, I guess safety professionals will deal solely on the data. How would you deal with that sort of default response? How would you deal with that?
For me, I'd speak to the data, make sure I acknowledge the position they're in and the whys that they're going there. But also challenge them with the basic question, where do you think that data point came from? It's the actions of people. Now let's start talking about the actions of people, because that will change your data. And if you're worried that your TRIF rating is too high, your TRIF is a function of people's actions. So let's start talking about those actions. And I would decentralize them from that data point, because that's not going to result in success. If they're so hung up on the number that they forget how that number got there, they're going to be hung up.
Good point. You talk about mentoring and building innovation and intuitive into your safety team. How do you do that at Modern?
Well, we restructured this year. Actually last year, we restructured and diversified our safety team, and it's got the typical silos of safety specialists out in the field. But I pulled one of our best specialists out in the field who presented at a previous session, and actually made him a researcher in safety excellence and research and innovation. And he is working with the Institute for Work and Health and CPWR in the States. We're carving research all the time. We're working with Bill Howitt in participating in research studies. And he brings back to the team the best evidence, and he shares it in micro sessions like this within our own team. And we share it not just in health and safety, but sustainability and innovation and construction services too, because again, all of them are interconnected.
Yeah, so that's really using the skills of those. So we've got a lot of young professionals that follow yourself, and myself being one of them. And as they enter in the profession of health and safety, it's still early in their career and development. What can young people bring to the conversation of intuition?
You know, they've got some really cool experiences that I think us older folks don't have. They think they see the world so differently. Both, one, they're technology geniuses. You know, I have to ask my nephew, who's less than 15, how to do things, and he teaches me every day. Listen to them and give them the respect of the experience they bring to the table, but also invite them to try, and, you know, within the boundaries and the safety net that you give them, to make mistakes and say, awesome, what did you learn from that? Not shame on you for being incorrect. But now let's talk about that, because even if their answer was incorrect, it was founded on something they understood. So is their understanding need to be reframed because the data was wrong maybe, or the information they were taught in the past was wrong, or did they understand it and interpret it wrong? So celebrate the fact that they might not have been perfect in their answer or their outcome, but celebrate the fact that they were willing to put themselves out there and discover it, monitor it, and then rebuild their skill set, so they have now some experience on the different opportunities for an answer or for a project success.
That's great, Erin. Some really really great leadership that you've been providing. You know, safety leadership. You basically are inspiring me to do better for myself. So thank you very much, Erin.
Oh, thanks, Dan.
Yeah, that was a great talk. So I'd like to pass it over now to Craig Laserve, and he's going to introduce Ron, and we'll continue on. Thank you. Go ahead, Craig. Mute.
Yeah, sorry, I've had to restart my computer. It crashed in the middle of Erin's presentation, but luckily I'll be able to read all the slides, watch the video. Listen, Ron Kolusky is the CPO of Ontario, and Ron, for the last 2 3/4 years, I think, has been doing it, and it probably feels a lot longer given all that's been going on lately. And I certainly, we talk probably at least every couple of weeks. We're looking at each other. But you know what, Ron, prior to his appointment as CPO, he was president and CEO of Public Services Health and Safety Association. And prior to that, he was with the Canadian Red Cross as Director General and National Executive Lead for Health Programs. And I think, you know, Ron's a past winner last year of the OGCA Safety Award for Doug Chalmers. I think he's making a magnificent impact as CPO. And I'm glad you are a CPO and continue to lead. And with that, I'm going to just turn the mic over to you, Ron.
Thank you. And Judith, if you could put the presentation up. But before I start, Erin, that was an absolutely phenomenal presentation. And, you know, there's a couple of things that you said that I just want to comment on. And one is, you know, I'm a big fan of The Art of War. And The Art of War has a statement that says, in the midst of chaos, there's also opportunity. And I think we've found that if we purely look at COVID as being you know, the year that never was, or we start looking at it negatively, there's been a lot of positive stuff that's come out of it. And you know, there's also a funny saying too, that when it comes to intuition, that the saying is, told you so, sincerely your intuition. So in a lot of cases, you know, you think about it's the right thing to do, and you don't. Probably the most famous, greatest quote that I like out of The Art of War is, never interrupt your enemy when he's making a mistake. So that's always the one that I always like the best when it comes to it. Just, you know, before I start, and I again, Erin, you know, when we start thinking about our strategy, where we're going forward, both, you know, it's been reviewed by the Prevention Council, and we're going out on a sort of a socialization tour over the next 6 to 8 weeks. The biggest part of the strategy is the need to look at evidence, measure our successes, and look at outcomes. Find the data to create the information to make the decision for us to move forward. So again, you're timely. And just a couple of people I'd like, you know, Erin is our chair of the Prevention Council, and thank you for that. And Dan is one of the members on the council. I think it's a very vibrant council that we're working with. And I'd just like to acknowledge Martha George. We've worked together over the past couple of years, and you've done a lot of work And it's so pleased to work with you and say hi. And also Leon Bartley with Dexterra. She's on the line. We've been working closely together for the last couple of years and a real true health and safety professional. So I want to give you a bit of an update here, and it'll probably sort of drift into some of the themes that Erin had talked about. One of those themes was the sharing early on in this COVID exercise. People started to talk. We started to meet regularly. As an industry, you can stand up proud that the construction industry really took a leadership role in being able to figure out what it needed and figure out what it needed to do. And it started from the bottom up. It made life easier for me. And you'll be really proud to know that the basis of all of the guidance material that the Ministry of Labor, Training and Skills Development and the Health and Safety Associations has issued since the beginning of COVID, the very first document emanated from the construction industry, specifically from OGCA and many of the league members and ResCon. It was the foundation for how we were going to interpret the public health documents with respect to this virus. And it's interesting, you know, it's not that I Google myself often, but I did, for whatever reason, Googled myself, and I found a letter that I sent out to industry on January 29th that said, you know, we might want to watch this thing that's happening and we might want to prepare for it. And I don't know whether it was more luck than brains, but it really demonstrated how, you know, the culmination of everything that we do in our careers and in our lives, that other brain that we have, that intuition comes to play, and we go, you know, I think there's something here we got to work on. And, you know, that was very clear when it came to a conversation that I had with David Frame and Andrew Pariser about, you know, let's see what we can do with respect to guidance. Next slide, please. So this early start, you know, March, we created those guidance, and we've created sub-guidance notes, and we've created videos, we've created posters. Now we're recreating those posters and re-updating all of those guidance notes because the science has changed. You know, we've evolved. We're starting to look at, what about winter time? You know, we started these guidelines going into summer, weren't we lucky? And now we're going into winter, and now you have to wear all those things and be all that more cautious in a separate environment. So we've asked people to do that. And then we've had the evolution of the delineation of who can stay open and who can't stay open, and regionalization. You know, we've had to go through almost 250 documents and realign them to links. And on top of that, there's been 1.1 million downloads now of that material, which is probably unheard of in terms of anything that government has produced that has been downloaded that much. So we are in the process of looking at that basic document created by construction, and we are reviewing it. Now, I would have liked to have reviewed it a lot sooner. However, things like, how about we go from green, yellow, orange, red, and gray? Why don't we develop that? And what is the implications on that? And then, you know, now we're starting to look at, can we model how long we're going to have to wear PPE if a vaccination is made readily available? And, you know, looking at that from a health and safety lens, and, you know, thinking about two-stage vaccinations and immunity periods, and what if somebody doesn't take it, and what is the implications on a workplace if we're not sure that somebody's standing up saying, I declare that there is no more COVID virus. You know, we have to be ever vigilant until somebody is able to do that. And then there's also the creation of appropriate tools that were made available for people that we thought after 30 years of the IRS, really understood what was going on. And when we got out there and said, people were going, what's a risk assessment? Or what's a hierarchy of controls? What is my responsibility? We found out that the workplace has changed dramatically. It's like, construction was easy in some ways because it has a respected and known hierarchy of participation, of direction. The safety had evolved very dramatically over the last 30 years. The concept of a tool talk, the investment in health and safety, just the pure economics of health and safety was already there. And the one thing that you see between labor, the symbiotic relationship between contractors and their labor force is, if I don't get the job done, I don't get paid. If I can't come to work, I don't get paid. And you started off with something that was very real, that resulted in some very, very keen collaborations early on, which was, I think, a testament to the success that construction had. So we got in there early. We realized that when the lockdown occurred, only part of construction was going, but you proved yourself within 6 weeks that construction had to stay open. And in the middle of May, we opened up the rest of construction. And I think when we started talking about gray zones, that there was really no reason to believe that construction would be affected by that because of the work that you've done in maintaining the safety of your sites and of your people, and staying alert. Next slide, please. So Erin had indicated, one of the things that you did early on, if you didn't have a mask, you called your buddy. You didn't let them flounder. But one of the things that really worked out very well is that we worked together and that we communicated. Craig had indicated we had talked every couple of weeks. Well, during the early on in the onset of COVID, we were having safety meetings on a weekly basis. We were having special meetings of the Section 21, not just waiting for them to happen every quarter, every month. We were having two sessions a week with the Prevention Council. So we were trying to articulate knowledge because we were all learning. And people would read an article that somebody else hadn't, they would share that article, and we became smarter collectively as opposed to individually. And as an industry, we became smarter and we shared. And there was no, when I often say I saw a letter that was signed by Pat Dillon and Jeff Smith from Ellis Don, congratulating the construction industry. And when when you see two people like that on the bottom of a letter, you say, okay, we've done something right. And it was a pretty proud moment when people were put their differences aside to say, what do we need to do to get the job done? Because the role that we play in the economy is important, but the protection of our staff is equally important. And that was really common for to see that happen within the industry. Next slide, please. So I stole this, actually kind of recreated it. It was in the Toronto Star article, had a thing that demonstrated where construction was. So this might be a little bit dated. It's about a month old in its side, but those smaller dots that you see there are representative of the building and construction and equipment construction sectors as compared to other people, other organizations. So again, an example of preparedness, an example of sharing information, an example of continuous learning and not sitting back on our laurels. And I think the biggest risk we face as we move into, as we are in the midst of this second phase, is keeping up the momentum with our staff, being vigilant on those tool talks, not just talking about how can you stay safe on the construction site, but how you're staying safe, getting to the construction site, getting home from the site, and also what are you doing at home? Those are there. Community spread has been the challenge we've had. Whether it's agriculture or any one of the meat processing, food processing plants, it is the community spread. It is what people bring in. So we have to be very vigilant. Our employees are our biggest asset, so helping keep them ahead of the curve is really important. I just wanted to show you that. I think you step back and step away and say, we know we can do that. What else can we do as an industry if we work together? Next slide there for a minute. So we do have new resources. There's an updated safety guide and template, which is really a consolidation of a lot of material to help business navigate through the new zones. Under the Reopening Ontario Act, the amendments that came in, employers must present a safety plan upon demand, whether it's an inspector or whether it's a bylaw officer, or whether it's general public. If you go into an essential business that's open, you have the right to ask them about their plan. And their plan has to focus on the key areas of physical distancing, hand hygiene, cough and sneeze hygiene, masking, and surface disinfectant. And that has to be included in the plan. And we've got the system working where we're hosting and recording webinars and seminars to help people move forward with this. And it's one thing to have it a gray zone or a lockdown in Peel and Toronto, but what happens when you're in Hastings County that was forever a green zone and all of a sudden they became yellow? And they've been operating under one set of principles for 7 months, where the urban centers in Ontario have been working under very restrictive conditions simply due to the concentration of people and the virus. So we have to develop and adapt our systems to be able to rapidly educate people who felt that they were immune, or who felt that, no, it's not going to happen here because we live in a fairly rural or remote area. So we do have those tools, and these tools can be shared and made available for you. So some of the other things that have come out of where we've been and sort of innovation in the point of crisis. So we've had some firms that have come up with rapid testing. I certainly made the industry available with the first rapid test that came out about a month ago. That was the 90-minute test. And when we were thinking about 4 days, a 90-minute test looked good, but probably a day later, the 15-minute test came out. So, when you're in a startup, you gotta know when to hold them and know when to fold them, because the 15-minute startup is something that the industry can do. And we've the province had secured 1.5 million rapid test antigen testing areas and wanted to do a pilot project to test the effectiveness of it. And I'm proud to say that construction is part of that testing. We've got one constructor that is actually doing it. They have about 5,000 employees on a site. There's still openings for more organizations if they want. They just have to call me, and I'll see what I can do for the second phase to get them on board. But we're looking at everything from long-term care homes to public safety agencies. What is needed to keep the economy rolling, but keep the essential business rolling, and overcome this challenge associated, well, I took my test, but I got to wait 4 days. Or what about false positives, and how do we deal with those things? The other thing that's just happening, and I just sent David and an update on it, and Craig, was there is a company that just came out with a COVID sensor. So we all know there's a carbon monoxide sensor that picks up carbon monoxide molecules and it goes off in the middle of the night. Well, they're in the process of perfecting a COVID filter that would go on your HEPA filter that would go on your ventilation system, that, when you're talking about, active screening and how do you ensure that the environment is safe to work within. So there's so many innovations that are going to come out of this thing. The only challenge is it's as big as a Buick right now, so you can't wear it like a radiation detector, but sooner or later things will be, microed to the point where we will be a much safer organization. And, the other interesting part is, and we made a special effort, as we did early on, to extend our credentialing period by 6 months for working at heights and essential training. What we did for the change the Reopening Act, we did keep health and safety training open in the gray areas, because we feel that those that train have the capacity and the capability to ensure safety. So they did incorporate that under ROA, and we did the same for ensuring that the skill trades examination centers stayed open, because this is part and parcel of ensuring that the industry stays active. Next slide, please. So upcoming to the construction guidelines to align resources. So I have been assured that they have started the process of revamping the construction guideline. I have been assured too that the participants that were involved in the original one will get a kick at the can before it's published. So that is assured. It will include things like developing the safety plan, specific clarity and use of mass in construction, screening, ventilation, and airflow, which are sort of the topical things that are coming out as we progress through this. Next slide, please. So this, the framework for adjusting and tightening public measures, as you know, you have PREVENT, which is largely rural Ontario. However, Thunder Bay and Hastings, as I indicated, is moving into the yellow. And then we have restrict, control, and lockdown. So there was some studies that came out of the UK that indicated that when they did the total lockdown, their incidence dropped by a third. We also know that the concerning aspect of this is that they have had models that if we don't really get a handle on this, we could see cases as high as 6,000 by Christmas time. So it's all up to us to be able to ensure that we maintain this as and control this as best as possible. And I'm very confident that that we can do that in specific industries. I can't reiterate enough the learnings that have come out of this. And I think that social scientists, environmental scientists, anybody that's involved in the human aspect of work and society, they're going to be studying the way we've responded to this for years. I took my car in to get its snow tires put on. And at the start of this, I took my car in to get my snow tires off. And what the person told me is you drove 1,200 kilometers in the 7.5 month period. We learned how to work from home. We learned about technology that had never been used before. We rapidly put out guidance for virtual learning. And I was on the call with one trainer who said that they had surpassed $1 million in virtual training in terms of the volume. So this is a game changer. People, the traveling, the cost associated with some forms of learning that can be done at your home or at your workstation. And this will all be the evolution of how we transfer knowledge, the culture that's changed. The old saying is that culture will eat strategy for breakfast. How we change our culture in a positive way is going to be really important from the learnings that we've undertaken. And I just, in closing, I just wanted to put a plug in for the construction industry on two areas. One is the work that, Modern Agra, Alice Dawn, Tridel, Dexterra have done in the area of anti-Black racism. We had a prevention council meeting where we spent 2 hours discussing this. The minister was there, the deputy was there. The ministers asked for some communications to go out across the construction industry on the importance of recognizing and dealing with anti-Black racism within the industry, and in fact within all industry. And the second part is the leadership that construction is taking in the terms of addressing mental health in the industry. This COVID has exacerbated issues that were already there, but it is more so. You've got people that are scared to come to work. You have people got scared to be at home. You got people that are scared to go out, to get their groceries. And it's a huge burden that's placed on workers that have to come to work in an already hard job to do. So I applaud the work that's being done, and I applaud the work that Bsckin has done with the construction against racism everywhere. I think we are maturing as an industry, and I say that as we, and I think that the learnings from this, we will go so far on what we're doing. So congratulations to everybody. And I think I might have one more slide, and then we can get to the, I guess, the chat box. This is just a slide that talks about the ROA. I got ahead of myself. These are what's required under ROA. And next slide. And the screening. So under ROA, workplaces have to implement screening for workers entering the work environment, and business organizations must, comply with the advice and recommendations issued by the chief medical officer. And we've published the tool, and the tool has matured over time. Everything has an unintended consequence, and I'm working with the building trades, because there's a requirement under the Long-Term Care Act that everybody has to be tested to go in. So in the middle of the night, when the furnace goes down in the nursing home, will the HVAC technician be trained? Because the HVAC technicians did not require to be trained. So there's some little nuances that we have to work through as a system to be able to make sure that on one hand, we fix something, and on the other hand, we have an unintended consequence. And I think in my study of black swan moments, that's the one thing: the reaction to the moment and the outcome of your reaction is important to be monitored so that you have a successful event. Next slide, please. Thank you for participating. If there's any questions, I don't see any. Maybe.
Yeah, there is some there, Ron. I'll field them. I have a couple myself.
What does active pre-screening workplace screening mean? What should be involved in mandatory pre-screening? Okay, if you go to that website, it does have a series of questions that are asked of people, and those questions have evolved since the first time that we did it. Some, depending on the organization, are requiring that people demonstrate that they've had a COVID test within the last 2 weeks. If you want to go see your grandmother in a nursing home, that's a requirement. I'm not sure if there's been some specific requirements on from a labor side that have said, you're mandatory other in those high-risk areas. Certainly, I've not heard of that in construction. So that would be, you're asking, you're almost asking your employees to attest that they do not demonstrate any symptoms, that they are not come in contact with people, they haven't traveled out of the country, so on and so forth. So it's the same thing that you get if you go to your dentist or your doctor's office. So you're just trying to make sure that people are safe to come in. And what construction
Ron?
companies? Yeah,
Ron, yeah, so we've got a Q&A feature at the bottom of your screen. If you wanted
Yeah.
to type in questions, we've got Ron on the hot seat here. So we'll definitely have some questions here. So maybe we'll field another one of Ian's, and then I've got one for you.
What
What-
construction companies require COVID-19 safety plans? All of them in the yellow, orange, and red zones.
And I have a related question to this one, but what does active face-to-face in person mean?
Okay, you put me on the spot on this one. I think it's that you are 15 minutes in contact with somebody in a close environment.
Yeah, we remember at the early stages, there was no definition in Ontario. We struggled with this as a group, for sure.
So that's why it's important, again, to talk to people about, you feel comfortable, you work together, you get in the truck together to go on another site, and you're not wearing your PPE, and you're in close contact with somebody, and it looks stupid if you sit in the back seat and somebody's in the front seat. We just got to reinforce that, because the concern is the community spread that occurs, and you bring that to work.
Right. It's about creating your circle small and
Yeah.
keep them as small as possible, minimizing contacts. We've heard instances of people on construction sites that carpool together, and they've gotten infected together because somebody picked it up on community spread and then brought it to the workplace, and they've given it to their work partner, and their ride mate, whatever you want to call it, and that's what happens. But so one of the questions is, when you're doing screening, passive versus active steps. And, there was a bunch of different ways of doing it. We're all doing the screening questionnaires, or we should be all doing screening questionnaires. But there is ways of doing it beyond that. There's temperature guns, there's O2 saturation. What's the current thinking thoughts on things like temperature and O2 saturation?
Well, well, my wife got refused at our meat market because she was wearing a coat and got too hot. But it's the kind of the passive screening is the attestation by the individual. The active screening might include more aggressive testing, more aggressive questioning, plus using temperature testing as an example. And certainly, the antigen testing, when that comes out, would be another form of the 15-minute. I know I've talked to some of the trades that have said, look, they don't mind doing that. They just want to be part of the solution.
Yeah.
And Ian has reminded me that at PEP, that was told that the safety plans are only required in the gray zone. They're required in the red zone for certain businesses like personal service business, cinemas, casinos, gymnasiums. There's about 8 that require a safety plan, but in the gray zone, you're right, Ian, every business that stays open requires a safety plan. Right.
And, when we're talking about community spread and we all hear different things, the Ministry of Labor, we talked about it. We had another call this morning in our safety committee. Information flow from the Ministry of Health. I think Bill was relating to some information that the Ministry of Health is now going to be able to communicate where spread's coming from. So we can say it's coming from restaurants, it's coming from bars, it's coming from the workplace, it's coming from someplace. And how is it getting spread? Until we actually put the diagnosis down to those specific events, how do we avoid those specific events if we don't know what they are? The answer isn't just all stay home. We have to sort of get specific, and information is the key. So what are we going to see in the near future here, Ron?
Well, part of well, we're going to try and improve the communication, but part of the challenge that we've had is health has recognized that with 34 medical officers of health, with the Ministry of Health, with Public Health Ontario, with Ontario Health, with long-term care, that there's a lot of different messaging going out. So they're trying to corral that. As I said earlier, one of our roles and goals through the information conduit is trying to keep information current and and transfer that information to various industries in the most expeditious way possible. One thing that we've identified clearly as a weakness in our system is that there are so many information flows in health and safety that, you know, Google becomes the #1 health and safety provider in the province. And, you know, one of the things we want to bring to the Prevention Council that we've talked about as an objective within the strategy, well, it's in the strategy, it's been to the council, and that is, how do we get one place to go to get information on health and safety? Whether it's, where do I get a training program by region? What is the latest information on COVID, or what is the latest information to avoid slips, trips, and falls? That is clearly an issue that we've got to come to grips with, because there are, you know, it's like high beams in a snowstorm when you Google health and safety. And what we want to do is, you know, separate junk science from what is real. I remember when we were creating the First Responder First website, when the PTSD legislation came out, well, one of the URLs that we were looking at was for a goat yoga junk science, you know, thing in Minnesota. That, you know, so we have to really be careful about that. So, you know, getting good information, but also where to go to get information. And actually, one part of the strategy is, in fact, that how we transfer and how information is translated. Because as, you know, Erin said in her, everybody's got their perspective, and everybody screens the information in different ways and interprets information in different ways. And, you know, in government, we try to make it the most convenient way possible for us, which may be one of the barriers to getting good information across to 99.9% of the people.
Yeah, good. You know, I will say, just after the question period, we've got a giveaway draw, something new on our thing. So just everybody's please staying tight. You know, Ron, what do you think is next for the industry? I know construction, and I'll just go on for a second, that, you know, construction itself, I think you've said it, is good. We're doing things well. We don't need to be complacent. We need to obviously do better. But construction as a whole, as long as we can keep our places clean and make sure that we don't have as many infections as the rest of the province, and that we make sure that we follow the right protocols, do you see us having to shut down again like we've done before?
Well, I think it's pretty ironic that the clean places were the worst ones and the dirty places were the best ones. I'll just say that as a bit of an irony in the process. But
yeah.
I haven't heard anything. Let me put it that way, that there's been no discussion. I think we've made it very clear, and I think from a political point of view, it's a balance. I know there's a concern about maintaining the infrastructure as an important component of economic recovery and viability, but I think with that comes a real sincere demonstration of competency by the industry. So as long as we maintain that level of rigor in the system, we can always argue that we are equipped and prepared. And, you know, if something does happen, that it may be the difference between full and partial, or it may be the difference of maintaining and staying the course. So it's all up to us to keep this boat floating.
For sure, for sure. See, there's no final questions. Anything else, anyone? If not, then I'm going to say thank you very much, Ron, for attending and give us your insight and the lowdown on the province, and for all that you do. And you at the CPO's office and the Ministry of Labor, thank you. Please continue to be vigilant and help us keep safe. And we'll continue to give the feedback that we need to help you do that as well.
You guys make it easy.
Yeah.
And congratulations on $28,000, Mr. LeSurf, for your
Thank you. You know,
November.
nearly 29. I will say, just to sort of do the next part, I am going to change my background. I wouldn't be me if I didn't do this. But, you know, a shameless plug for November, which is a fabulous, you know, about men's health. And I've grown the little thing here, and it's great. And raised nearly $29,000. So I'm hoping to get a little bit more. Donations are not done. So by all means, go to November and type in Craig LeSurf, and happy to have contributions to such a great cause. So with that said, we have a donation that was given to us from Call It Heart, and it's a petition. And so Judith, you have a little slide you can bring up, share a screen, and we're going to draw a name for it. And what it is a privacy screen that they've been using in hospitals and healthcare facilities. And it's a little booth. Judith, do you have that? You're on mute, Judith. Okay, so what we have, she's going to draw there we go, from Spectrum. And it's what they've offered to do is donate this little privacy cubicle. And it's a screen cubby for your chair. And so it helps keep patients and people safe. And we thought it was appropriate that the person, we could draw their name, and they, on behalf of Spectrum, will get to donate it to a healthcare institution or a provider of their choice. So with that, Judith, pull out the name if you wouldn't mind.
Craig, I sent you a quick message. I scrambled all the participants and I did send you a name.
Oh, there we go.
Thank you.
Let me find it here. You did. Oh, there we go. Huh. Vittorio Lagacio, I think I'm from Bsckin. So Vittoria, I think. My bad. I'm sorry. I butchered that name totally. And I'm glad you were able to stick with the program and get the sound working. So well done. Thank you very much. So with that, turn it back over to Dan.
Thanks, Craig. Well, that was another excellent presentation. So I'd like to thank Ron and Erin. You know, the presentation is very informative. It's a privilege to work with both of you on the Prevention Council, the hard work you guys are doing, the progress that we're making there. Also, David and Craig, also the work that you guys are doing with the League of Champions. It's an honor to be hosting these events myself also too. So, but also it's actually the people that are attending these events, the members, and also those that are those that want to be members that would like to join. Please go on our website, the League of Champions website. Check it out. Judith's done a great job of actually making it better. So, in that, I'd like to sort of close off and thanks everybody. Be safe. Work well, and we look forward to seeing you on December 14th when we have our next webinar. So Judith, I'll just close off with our final song of the League of Champions.
Thank you.
Thank you, Ron. Thanks, Tom. Erin.
Okay. We are the
There we go. And since we got December 14th coming up, we'll wish everybody a Merry Christmas at the December 14th event. So
absolutely. Thanks, everyone.
Thank you, everybody, for being here. Good afternoon.
Dan, Dave, do you want to hang for a minute?
We had some real sound trouble today, gentlemen.
Yeah, hold up. All the participants are still here.
Absolutely.